So tonight, Ancestor House, I have some wonderful guests for you. In fact, tonight we're going to be dealing with dementia. Now, when we talk about the brain, our computer, a very important computer, the human brain, sometimes we forget that, mental health is really a huge thing. We talk about our physical health, even our spiritual health, but sometimes we overlook the mental health. And when we talk about the brain, we think about all of the stories that have been carried with us across the Atlantic from Africa, centuries of stories. In fact, traditions, spiritual systems. I remember going to Brazil and, seeing a sign of all the orishas and just being so amazed that, this still entrenched in Catholicism, disguised in Catholicism, but yet, part of the fabric of Bahia. And it was beautiful to see, but this language, this memory has been carried and transported throughout centuries and has all been done with this beautiful vessel, the brain. So I have some wonderful panelists this evening who can really give us some insight into sometimes something which we often forget to talk about. When we think about forgetfulness, like myself, I need to have my cards here just so that I don't forget what I'm going to say. When we talk about these things, we kind of think, oh, well, it's just a little bit of forgetfulness. But some people are really suffering. And the panelists that we have this evening will be talking about their experiences, their knowledge, to be able to be of some assistance to you. Come on in. This is Ancestor House. Pull up a seat and join me.
We must learn and tell our story, heal the pain and raise the glory. Tell it. We must learn and tell our story, heal the pain and raise the glory. Tell it. Not to know the family story is bad. Surveillance. Not to want to know it is worse. For to pass on ignorance to someone is like, it's like passing on a curse. And it will curse your father, curse your mother, curse your sister, curse your brother. And every time you come close to one another, it will be there in between to separate.
Welcome to Ancestor House, and my name is Dami Akanusi, and as I said, today we're going to be dealing with dementia. Dementia and Alzheimer's, some of the illnesses that sometimes impact us depending on our age, but not often always on our age. So in fact, there's a lot of information that a lot of us out there know, or just there's myths that we guess about when it comes to dementia. But in the studio today, we have our guests who can actually shed some light. Some amazing guests who are actually out there in the community doing their outreach and also bringing the awareness to a wider audience of people, just so that we can start dealing and, have the conversation about this. This is something that maybe comes for us all, but enough about that. Let me introduce our wonderful guests. We have today Asha Tari, yes, and of course Wendy Tankin. Thank you very much for being with us today. And now you two have something in common, of course, the conversation around dementia and Alzheimer's and how we deal with that within our communities and some of the solutions that we can, that we can utilize to help others. First of all, tell me a little bit about yourself and why you're here today.
I'm actually a licensed mental health specialist, and I've been working in the community doing work with people from adolescence through later years in mental health, doing assessments, running groups, talking with families about mental illness, and just addressing the stigma that we have in our communities about what mental illness is and how we treat it. So I'm really happy to be here tonight to talk about this. And
I welcome you to Ancestor House. Thank you very much. And Wendy, tell me about, you work for the Alzheimer's Association.
Yes,
tell me a little bit about yourself.
Alzheimer's Association New York City chapter. I'm a licensed clinical social worker, and I manage the Family Caregiver Support Group program. And we have groups all over the 5 boroughs. We have many groups in Manhattan, at least 60, and several groups uptown, including Harlem and Washington Heights. And I lead 4 groups, including a bereavement group, groups for spouses, adult children, and also for young adult children, 21 to 35, who have different issues than older adult children.
Absolutely.
And I also work with other staff at the chapter who run the 24/7 helpline, who run the Safe Return program, who do training and education for professional caregivers and for family caregivers. And also I work with the people who actually do the raising of money, because all of our services are free of charge.
Absolutely. Now, the thing, with that as well is that, this is something that seems to be impacting a lot more people than we originally thought. And, one of the things that's really interested me is that, there seems to have been, prior to, this conversation, a lack of conversation about dementia, also about Alzheimer's, and these kind of icky illnesses that affect our brains that we'd rather just sweep underneath the carpet. Asha, what have you found just being out in the community when it comes to this particular illness of dementia, in terms of the conversation? Are people talking about it now?
I don't think the conversation's really changed that much in my experience. I think people are really looking for where to begin. So they don't know really if they should be talking to their doctor first, or if they should be looking for some community support. But I just find that when typically families find that there's a loved one in the family who's suffering from dementia, they're trying to see where this is going to take them, how much really needs to go in terms of the intervention. So I've been able to direct people to the Alzheimer's Association, actually, but also to support groups, and to try to really bridge other relatives in the family into what we're trying to do to help families, because I think it's not an individual isolated issue, it's really a family issue when someone's suffering in this particular way. And so I try to really bring the education about what is dementia and how Alzheimer's is a subtype of dementia as well, and just try to normalize the changes that they're going to see, because a lot of times people are quite surprised when the personality changes with dementia and it goes into Alzheimer's. And there's a lot of fear around what's going to happen to their loved one if they do get intervention in the community from other supports.
Right, right. So now, what is dementia? Like, when we describe it, I mean, it's not just forgetfulness, is it?
Well, dementia actually is a medical term, and it was first used in 1801, actually in France. Comes from a French word meaning demence. And we define it as the loss of cognitive functioning, so that a person isn't able to think, isn't able to relate, can't make decisions, loses the ability to actually orient him or herself to a place, to other people. And so that's the, when we say dementia, it's like saying cancer. There are different kinds of cancers. Well, there are different kinds of dementias. There are probably about 70 in all. But the major dementias are Alzheimer's, vascular dementia, Lewy body, and frontotemporal lobe dementia. So at the association, our groups are for all of those people. And there's a special group for people with Lewy body. There's also a special group for people with frontotemporal lobe dementia.
Right,
But the groups are also all people who have all these dementias also come together, because the course is pretty much the same.
Right, right. So what, when, you're at home, you don't know, first of all, all you know is that you're starting to forget some things. I personally have an issue with my keys and lots of other things. So I don't know when, if there's early onset dementia, but, how would one recognize the signs? As you said, they fall within so many different categories. So, what's the difference between, my forgetfulness and, forgetting where I've put my keys and forgetting that I said I would be somewhere at a certain time and, that type of thing, to someone who is actually experiencing, their cognitive abilities starting to change? Is there a point when you think, aha, this is the time to go to the doctor, or this is when I need to speak to my family?
Well, and I'm sure you could chime in as well. Dementia is going to take on different forms. And so there's a difference between forgetting where your keys are in this moment or the next, and there's significant changes over time in your behavior and your personality. People tend to forget short-term memories affected. over time, and people tend to forget sort of basic things that they would normally remember, where they not only put their keys, but sort of basic patterns of behavior, language changes. So there's mild cognitive impairment that people tend to have, and it progresses, and there's different things that factor into that as well. So you want to definitely go and get checkups from your doctor and get screenings to really try to rule out if there are not other things that are impacting your memory, such as other medical conditions that would differentiate between normal aging and something more progressive like Alzheimer's.
Right. I guess, you know, kind of one way to look at this, which I find helpful, is that it's one thing to forget where you put your keys, but it's another thing to forget that you actually have a key in your hand and what the key does. Okay. That's a disorientation, whereas you forget where your keys are. You know, you may get a little anxious about that, but then, you know, usually after a couple of minutes, if you relax, your memory comes back. You know, you have a retrieval system that is still working in your brain. But a person who's developing, I'm going to say Alzheimer's, loses that ability to retrieve. And as a result, what we see is the person getting more and more agitated and even suspicious, and beginning to think that it's not that I lost my key, it's that you took my key and you put it somewhere.
And we've seen that. We've seen that, you know, within our families, you know, we say the grumpy grandma who's there always, you know, like
on guard.
Yeah, on guard, suspicious, annoyed, forgetful.
Paranoid.
Yeah,
paranoid.
and but you know,
but it's understandable,
there's a reason for this.
right? Because what's happening to that person is that they're losing control of what they've always been in control of, what's seemed automatic, because we don't, you know, after a while, we do things routinely without thinking about them. We come home, we open the door, we know we're home. We don't have that kind of, we don't get to our door and not realize that it's a door and how to use the key.
It's habitual, right? So it's all the kind of conditioned habits sometimes, it seems that we lose those, and that would be really, really scary.
Really, and so the person feels incredibly vulnerable and exposed, and especially exposed to shame. Shame that they feel internally themselves, but also ashamed in front of people because they've always been in control, they've always been strong, they've always been independent, and suddenly they begin to lose that. And it's very, very hard to recognize that about yourself. So that's why initially and throughout the disease, and this is one of the very difficult things to work with, and what our staff is expert at working with, and what we train family caregivers to work with, and that is the fear that's involved, and the agitation, and the denial. That's really what I want to get to. The denial.
Let's also get to what when you mentioned the caregivers. I mean, it's you know, all of the different processes that the person is going through, but then at the same time, as a caregiver or someone who was part of that family, you have to then adjust to this new person. Like you said earlier, almost the new personality, you know, changing of mood and that type of thing. Now, I know that you grew up and you know, in this environment, and you know, you were exposed to people and family members who have dementia. You know, how did that impact your life, you know, in terms of having to deal, I mean, when I say having to deal, but, you know, you're dealing with someone who you knew to be, you know, one person, and then maybe, you know, their characters has evolved and they're having to make their own adjustments. How did you adapt yourself?
Well, I think as Wendy said too, there's a change in your self-concept as a person suffering from dementia, and then there's also a change in the family's concept of who you are. So you are someone in a family who exhibits a certain personality, and you play a certain role in that family. And so that changes for not only the person who's suffering, but also the people who are witnessing that change. And so in my case, where I had a loved one, she was my grandmother, she developed early onset dementia, and she was in her late 50s at the time. And it was just some normal aging, forgetfulness, and then it sort of progressed to less recognition of relatives, her husband, And of course, as it progressed even further, she lost the ability to communicate effectively. Her language skills diminished. And so it was difficult because here she was, the matriarch of the family. We all depended on her for so many things in our family. And it was an adjustment for all of us involved. And so we had to provide a lot of education to my grandfather about what he was experiencing as a caregiver. She became violent over time. And it was challenging because we decided to keep her in the home and work with her and work with my grandfather and just bring in supports in the family and bring in a home attendant as well to help her because she became very resistant. She became resistant to us combing her hair and resistant to eating and resistant to bathing. And these are all the different changes that a lot of times you see in your family who's suffering from the same illness.
Can I ask you a question? Did you call the Alzheimer's Association?
No, I didn't at that time.
Oh.
The Alzheimer's Association wasn't as prominent at that point. This is over
so what
15
did you-
years ago.
what did you do?
But we typically just, would do what we've been doing in our family, which is try to bring other supports in the family around her. People would take shifts to assist us. So there was a shift of a caregiver early in the day that would be with her and tried to help her with her basic daily living activities. And then we would have another relative come in the evening and they would take a different shift, sometimes even stay overnight because she would get up in the middle of the night, which is typical of people suffering from Alzheimer's. We didn't know if she would start to wander. And so we wanted to have someone there to help her take the load off my grandfather and just make it a little bit easier, provide respite for him. And it was just a challenge because her state of dementia progressed rapidly. And so we saw her go from being able to be an independent woman who was very self-assured and confident to having to depend on someone else for all of her daily living activities. And that was hard. That was very hard.
I mean, it must be hard as well for both sides, when you know that you're slipping away. And, is it a common thing, and especially within communities of color as well, that it, in terms of the onset of Alzheimer's or dementia, with what prevalence it happens, between men and women, do young people get it? Is this, are these kind of like general questions that people ask you when they call up, but needing to know more, that they feel that their family are suffering?
Well, typically in my experience with the clients that I work with, we'll get lots of questions about, forgetfulness. And is this just because I'm getting older? And so it doesn't mean because you're aging, you will develop Alzheimer's. Okay, that's sometimes a myth out there. But there's normal cognitive impairment that comes with aging, but also with multiple medical conditions that people have. And we know from being persons of color that there's so many chronic medical conditions in our communities that sometimes impair your cognitive functioning. And so what we tend to do is just talk people through getting into their doctor's office, getting a screening, getting an exam, an annual exam, and just getting your blood done, get your blood tests taken, trying to exercise, trying to eat right. These are some of the discussions I have with my patients, but also I see that in people who suffer from dementia in communities of color, sometimes it does tend to happen a little bit younger. It often does affect women, but it can of course affect men as well. And depending on when they actually develop some of the signs and symptoms, it's going to progress over time. There's medications to treat it, but the medications only help with some of the symptoms. It doesn't help in recovery.
Right. So is there anything, Wendy, that we can do in terms of intervention or early intervention so that, I don't know if it's something that can be prevented, but are there steps that people can take so that they can avoid this?
Well, I think what we want people to do is take good care of themselves. And so we want people to eat well and we want people to exercise because that's been shown to have very positive effects on the brain. But, if you take care of your heart, if you take care of, your digestive system, if you stop eating sugar or, so that you are not at risk for diabetes, if you deal with your depression so that you're not at risk for, whether it's, you know, you're extremely anxious and so you're at risk for high blood pressure, or if that's in your family. So if you take care of all of that, then there's never a guarantee. I mean, there is no guarantee, but the hope is that you will have, your brain will be in good shape. I mean, people do have what they call brain reserves, and so those with large brain reserves are able to compensate longer.
And what is a
for
brain reserve?
Well, I mean, the way I understand it, and I'm not a scientist, you know, I think of myself more as like the poet, but the way I understand it is that, you know, people with brain reserves use more of their brain. You know, I think we don't use a lot of our brain, and I don't remember what the percentage of the brain that we use, but it's pretty shocking how little of our brain we use. And what does that have to do with? How little we really think about things. You know, we're so routinized and, you know, kind of these, you know, we're all on this, you know, what are the...
Like a wagon wheel?
Yeah, a wagon wheel, whatever. You know, we don't stop and think enough. You know, we don't really reflect.
Ponder on life.
Yeah,
do we have the
ponder on
time?
life.
Do we have the time
Well, that's
anymore?
another problem in our society, and time seems to be speeding up, right? I mean, it's not only that I'm getting older, which is true, but you know, with all the technology that we have, we want things even more instantly than we ever did before, right? But in other words, so if you think, if you speak different languages, if you just like to think and meditate and contemplate and just find that you like to talk, but not just, you know, crazy, silly, stupid talk, but, you know, really like to get into things, then you're using more of your brain. So the more you use, the more you have in reserve to compensate. And it's amazing how long people can compensate for their, you know, for what they're losing. You know, that's why in the very early stages, and the chapter does have an early stage program also.
This is the Alzheimer's
This is the
Association.
Alzheimer's Association New York City chapter. But in the early stages, people can cover up their memory loss for a very long time. And so family members often go nuts because an outsider will meet, let's say, you know, let's say if it's my husband, and they'll think he's perfectly fine if they spend, you know, an hour.
Right.
But, you know, here I am as the wife being with him all day and all night, and I know that something is wrong. On the other hand, it's great that the person can compensate because then they're able to stay in the social world longer, because that's something that happens to people with dementia. They're really excluded from the social world, which actually the New York City chapter is also trying to do something about, and we've started what we call an Alzheimer's Cafe, and that's for people, family caregiver and the person with dementia, and I prefer using the word now deeply forgetful.
Rather than dementia?
Rather than dementia, because I think then you can see what's going on with the person, as opposed to dementia, which, as I said, it's a medical term. It's a very cold word.
Right, right.
So, and just one other thing that the chapter is doing, this coming Wednesday on April 10th, there's a meeting called Hope, Ethics, and the Deeply Forgetful. And it's at the New York Times Center. I think that's on West 43rd.
And it's open to everybody?
It's open to everybody. It's free. And it's from 5:30 to 8. And you can go to the chapter website, www.alznyc.org.
ALZ, right.
nyc.org, and find out about this amazing meeting. There are two incredible people who are going to be speaking. Maybe you've heard of Stephen Post. He's the
And
ethicist.
Stephen Post is, who's Stephen Post?
Well, he's a very well-known medical ethicist, and for many years, since the 80s, he's chosen to work on the subject of aging and Alzheimer's with the deeply forgetful.
Wonderful.
And
so he's going to bring that to the
Yes,
discussion.
he's
'cause
bringing that.
That was another thing, actually,
Right.
and we'll definitely repeat that to the audience before we go.
Yeah.
This idea of old age, because, you know, like you said, it doesn't necessarily affect, it's not necessarily, you know,
young
kind of
person's
relative to age, but you know, we all know that as you get older, we tend to believe that all of these things are assigned to being, you know, elderly, basically. So we'll often start labeling people, oh, you're so crazy, or that, you know, and I think you mentioned as well when we spoke this whole idea that it, is slightly criminalized in a sense, the forgetfulness or the being suspicious or paranoid and over-irritable. But yet, there's an issue, just as we might treat other illnesses, whether it's high blood pressure or that type of thing. We pay close attention to that, and we demand that you go to the hospital.
Well, the other thing is that, if you look at the person always as a person and not as the disease, then everything changes for you. And that's something we need to train people to do, because, family caregivers, this is they're encountering this whole, as you were saying, these personality changes. And, it's really difficult to remember that this is still the same person. Yes, he's changed, and yes, he doesn't understand what he used to understand, but you do. But if you see it, he's still a person. He's always a person. Then it changes it. Like, an example is, and this doesn't always happen, but this is to me a very dramatic, example. Because, nursing homes try as hard as they can to take care of people. They're understaffed, staff is underpaid, so they're under a lot of pressure anyway. So this isn't about blaming anybody. This is just about a situation that happened that I happen to know about. In a nursing home, a woman was in her, hospital gown in an area where all the public could see her. Mm-hmm. And she was screaming, and she was being ignored. Just ignored. And this was going on all the time. People, that's what happens in nursing homes and hospitals. There are so many noises, all the bells and the TVs that you hear. And the radio. All right, so she was being ignored. And then there was a new social worker who came on board on that floor. And one of the first things she did was just stoop down at the same height as the woman was in her wheelchair. And she started to talk to her. What is your name? What was your life like? Just asking questions that the woman was actually able to answer. Mm-hmm. And she found out that the woman had been a tailor, and that it was very important to her to be dressed properly.
Aww.
Right. And all she did was talk to the staff, and they were very willing to do that and dress her properly. Mm-hmm. And lo and behold, she sat in the same place but dressed properly. She was okay, and she was fine. Right, but that's seeing her as a person, not
exactly,
as this
and having
crazy,
that respect, as we should, for our elders. And how far away have we come from this connection? At the beginning, when I talked about even our stories, traveling from Africa to Brazil, even through the Orishas, you can find out and understand the spiritual traditions and just wonderful history and knowledge that has been transported for hundreds of thousands of years. And so, there's something that's right up here, in terms of our brains. So, why does it feel that it's more prevalent now? And in terms of the relationships that we have with people in our community, what are the things that we can do to have that compassion? Because I feel like in this story, there's something that we're not discussing, which is that love and compassion that says we have to spend time with these people. It's very easy to say, okay, well, look, go ahead about your craziness. I've got things to do. But, you've had this as part of your family. Maybe it's something you can't run from, but you find yourself now in this area as well. For others who are, struggling to really pinpoint how they can, affect their relationships, what would you say to them?
I think, one, you have to really depend on not only the people in your family, but the community as well. I know from having referred people to the Alzheimer's Association, they have certain things in place for the family caregivers. So, for example, with some of my patients who have members in their family who wander, we've talked about making sure they register their names with the local police department so that they are identified with a photo and a description of who that person is if that loved one happens to go wandering at any point during the day. Because it's very frightening. If you're a working person and you have a loved one who's suffering, you can't spend your whole day with that loved one. You have to go to work, you have to feed your kids, you have to run errands. And so sometimes you're going to need additional supports, and also not everyone comes from a large family, or families don't live close together anymore. So how do you actually provide support that's affordable, that's going to be in your neighborhood where you feel comfortable and safe and you hope that your relative is going to adapt to.
Right.
Because there are times where I've had patients who their behavior had become so extreme and impulsive that home care just wasn't an option. They had run away so many home attendants, there were so many people who had rotated in and out of the home that it was almost a demand of the caregiver to actually have to be there with that person as the disease progressed. So I think going back to what Wendy was saying earlier is that we have to continue to treat people as people. And I know from being in mental health for so long that we're trying to move out of the medical model of the way in which we treat our family members and our loved ones and really treat them as a person suffering with the illness instead of the person who is the illness. Because there's going to be a change in who that person is over time, just as there's a change from you going from an adolescent to an adult and you see different things that develop in your personality. But it's also working with the loved ones to really get them to understand over time that there will be differences, there will be changes, and you have to work side by side to help them in this process because it's going to be quite challenging for them as well as it is for the patient.
Absolutely. And like you said, it's the community element
Well,
of this.
you know, the New York City chapter has core programs, and the program that that I run, the support group program, is one of them, and that's we try to create support groups in local areas so that they're as convenient geographically as possible, and also run by group leaders who are trained at the association, who know something about the disease, about caregivers, and also about group dynamics. And there's the Safe Return program, which works with the police department, but it's a special database so that, when people join that database, then if their loved one gets lost, the police know that they're on the Safe Return database, so that we tell caregivers, family caregivers, to call 911, say they're on the Safe Return database. Then the police know to put out all kinds of
alerts and
alerts to all these different places.
So they don't get incarcerated. Is that to
No.
ensure
Well,
that?
no,
Or
so that they also aren't exploited,
Right,
and
okay.
also that they're not seen as people who are doing any kind of criminal activity or anything else. But you want to make sure that the community is aware that there's someone missing.
Right, but also the association, the chapter does work with police departments to train the police, because somebody with dementia could become really, unfortunately agitated and violent. And I don't think it's that person's fault. I think that it's sometimes a natural reaction to somebody like just pouncing on them,
Right,
or,
absolutely.
suddenly like trying to do something without telling them what it is first. So the chapter does that, works with the police department, and that's locally also in all different communities. And then there's the legal financial meeting, because people need to know what they should do legally and financially, because it's a long disease. Unfortunately, it's expensive. With all the cuts and all the changes in look-backs and whatnot for people who need Medicaid, and that could be me,
Have these all been cut when it comes to this particular type of service?
Well, it's being fought, but some things, yes. Like there's now a 5-year look back for nursing home care. So anyway, so the chapter educates people about that, and then Medicaid home care, and then there are monthly meetings. So what I'm trying to say is that it's really important that people know about what's offered to them, because it is scary. And it does take people a while to realize what is going on with their relative, because at first it doesn't, it seems like quirky behavior or something like that.
Right.
But then as you realize that this person could be in danger, but the person himself is still in denial, because
Right.
self-awareness is also changing, and also it's terrifying to realize. And then there's also the shame involved, because...
Yeah, you mentioned this earlier, the shame, and
Yeah.
because especially when you think about the independence, I cannot imagine suddenly having to, just do a whole 180 in terms of what I was naturally able to do. Talk less of the things that I, have my aspirations for and I want to do. So, it's almost acknowledging that that's all now
Well, let me
off
give
the
you
table.
an example. Yeah, my father had a progressive neurological disease called progressive supranuclear palsy. It's like ALS. And he was physically affected. It's a movement disorder, and so he was like becoming paralyzed. That's the palsy. He wanted home care, but he still had his memory. He was still rational. He still could think clearly about what he needed. My mother had dementia. She had vascular dementia and maybe also Alzheimer's. She didn't want home care because she didn't realize that she needed help, because she still thought of herself in a certain way, right? You know, independent, the head of the family, you know, the wife, you know. So that's the problem for, you know, family caregivers taking care of somebody with, you know, I keep saying dementia, but I mean who also are just not in touch with reality in the same way that we are.
Absolutely.
You know.
And, you know, and do you think there's an added stigma as well? Just, you know, just in terms of like seeing the news where, you know, occasionally especially when it comes to young black men, you know, there's this kind of, it's almost like, you know, this idea that they're predisposed to, you know, whether we call it mental illness or certain things that might affect, are seen to affect or statistically are said to affect the black community more. You know, do you think there's less of a tolerance in terms of being able to deal with these situations, being able to, you know, find the support that is needed as a community to all, you know, unite together over this particular issue? You know, yeah.
I think mental illness in America is a systemic problem to begin with.
Okay.
And I think in communities of color, it's so compounded by lack of awareness of what mental illness looks like, even dementia, as well as lack of support from the federal government, as well as local communities to be able to support the amount of services that's necessary for people to get treatment, real comprehensive quality treatment. So even in the case where someone could be mentally ill in communities of color, you tend to not often have trained professionals from, let's say, the police department who would intervene if a person is becoming agitated or violent or suspicious and feel threatened, and they're trying to just protect their own boundaries and their own personal space when law enforcement is then involved. So you'll have law enforcement who comes in if there's a call from, you know, a local neighbor, if someone's, let's say, exhibiting some odd behaviors. And if there's no history present or a history giver on that person's mental illness, then you often have a combative situation. So it's not where we're seeing a lot of the community supports in neighborhoods that people may suffer from mental illness at high incidences, so they're criminalized. They're often criminalized for extended periods of time with petty accounts of any kind of criminal behavior. And so you have an overabundant amount of people of color who are institutionalized because there's an underlying mental illness that's either undiagnosed or untreated. So even in the case of dementia or Alzheimer's, this spans the gamut. And so I think that when we talk about mental illness and prevention, we have to talk about federal intervention. We have to talk about Obamacare and what that's going to mean for people to receive quality assistance, because it doesn't mean that even with Obamacare being intact, is that going to cover the entire realm of services that a person who's suffering from mental illness is going to receive.
Absolutely. And what's interesting in that as well is that there's so many different things that can feed into it. So whether we're talking about dementia and you know, Alzheimer's, we're also talking about the depression that could lead to it. We're talking about you know, high blood pressure, eating too much sugar, all of the different other health elements that sometimes, and especially within certain communities, and you know, definitely around my area in Bed-Stuy, you know, the corners are just filled with, you know, Chinese food and delis and, you know, just a lack of access to this healthy living that is needed in order to prevent some of these things.
Right, and I also think that there is an inequity of, you know, mental health and medical services in, you know, poor communities, in all poor communities, and in communities of color. And I think that's part of, you know, that's a big problem for all of us. So I think that, that we have to work to change that. We have to make sure that money is spent on better programs and services. We have to make sure that we have better mental health centers. We have to make sure we have day programs for people, you know, who are deeply forgetful, respite programs for family caregivers. I mean, I still believe that, you know, despite all the talk about no money, I believe that there is money for all of this. And that instead of impoverishing us, the family caregivers, we should use the money that we give to the federal, state, and local, you know, in taxes to the kinds of programs that we all need. Because that's what I see. I see people being impoverished. I see poor people being even more impoverished. And I see people in the middle classes being impoverished. And I think that's a tragedy. And I think that it's going to have untold, you know, effects on the future. I mean, this is my fear about the future, that we're all going to be impoverished. We're all going to be poor. And I don't think that has to happen. You know, I mean, we all, you know, I mean, I think we know about the 1% and the 99% of which I'm a part of, and everybody who I work with, both, you know, professionals and family caregivers, are that 99%.
Absolutely, and doing a lot of the work.
And doing all the work. In fact, you know, it's amazing how much the unpaid labor of family caregivers amounts to. It's like maybe $13 billion, you know, and the number of hours is in the trillions that we give. I mean, as a caregiver for both of my parents, it was another job.
Well, it is, isn't it? And we have to acknowledge as well all of the young people who find themselves caregivers at very, very early ages, still have to help bring up the siblings, get themselves to school, get themselves fed, that type of thing. So it's certainly a huge, huge issue. And you know, one of the other things that you know, brings us together as well is this idea of outreach. And I know that, you know, you're very much involved, and of course, obviously, with the Alzheimer's Association, you're very much involved. And one of the reasons we're sitting here today as well is in discussion of a film, Barbasol, which was made by Ralph Scott, which actually was the reason that, you know, we decided to put the show together. And, you know, and talk about how, you know, different ways that people can understand and learn more about dementia and Alzheimer's and, you know, other illnesses that affect the brain. And, you know, this, I would call it sort of activism artistry, really, you know, using film as a way to engage people on subject matters that affect us, you know, social issues. And then obviously with you, you guys, with your organizations outreaching, you know, directly in the field to people, and, you know, providing services as well so that people understand and know what's going on. Some of the things that you do, I know that you said you have a radio show as well. How else do you get the message out to people that they, you know, one, there is a support system, even if they don't know where it is at that point, and two, that they're not on their own when they're dealing with such illnesses?
Well, our organization is the Collective Advocates for Social Change and Development, and we focus on social issues that impact communities of color. So this year we have a campaign going on about human trafficking, but we're going to be working more towards building awareness about mental illness, because even as trafficking is a social, psychological illness, I think, in our society and in our world, so is mental illness.
And this is trafficking of children in particular?
Human trafficking of people. So even with mental illness, for example, and dementia being classified in the DSM-4 as one of the mental health illnesses, I think one of the ways that we work hard is to raise awareness through not only grassroots efforts, but also using the media. So Ralph's film Barbasol is actually a great way to have an entertaining way to introduce the discussions about mental illness, social classifications, because this is really what we're talking about. People are classified oftentimes by who they are, what they do, and what they have, even if they have a mental illness. So I think having a film be able to introduce a relationship change that Barbasol shows, from going through seeing your parent as this superhero almost to someone who can't do for themselves as they age, and what we do as loved ones to support that gradual change is important. So as we move more in our social advocacy campaigns, we're going to be raising awareness about how we start conversations, typically in communications with people who would never sit down and have a one-on-one about this kind of information, and what we're going to then do about it. So it's going from educating to advocating to then mentoring people to become active and doing something different than what they've probably not ever done before.
Wonderful. And I completely like the idea of the cafes that you mentioned, bringing people together
Right.
over, over
Coffee
this issue.
and,
And
right,
yeah.
in a beautiful environment. Also, again, it's free. But the woman at the association who does outreach to the African American community unfortunately has been sick, or she would have been here, and her name is Paula Rice, and she's well known now throughout the city in the African American community here in in Manhattan, in Queens, in Brooklyn, and in the Bronx. And I wish she could have been here today because she could tell you more about what she's doing. But we do have educational meetings locally. I'm not exactly sure where in Harlem, but they are, and in Queens. And again, this is information that's on the website, www.alznyc.org. There are events that that take place, annually for Black History Month, for example. That's where I saw Barbasol, and I liked it very much. But I think our effort is to get people involved in advocating for the deeply forgetful. And we're joined with other organizations who work with the elderly and also with dementia. And it's hard not to say that word. And because it takes a village. It takes a huge village to make the kind of changes that we want, because we want attitudes to change. We want more services.
Absolutely.
We want to educate ourselves. I think we all need to begin to feel more comfortable being forgetful.
Right. Right.
Like in a way, like, why do we make such a big deal? I forget a name. I mean, it's only because it's socially embarrassing. It really is.
Yeah.
So
yeah.
I mean, that's how I identify with the deeply forgetful, because when I forget a name, I feel it's embarrassing. I want to.
Sure. But it's when it becomes dangerous that
Yeah.
obviously we're one of the reasons we're here, because of that concern for loved ones when they are at a point where they're wandering perhaps, or
Right.
they've completely lost.
Or they're still driving and they shouldn't be driving. And
Right,
they shouldn't
right.
Be, right.
And
living alone. Yeah.
Exactly. And and I think as well it's a topic that we're starting to really just talk about it as is. That's what it is, and how do we deal with this now, rather than keep quiet, but we know that she's
I think
losing her
people are
marbles.
having this conversation more and more.
Well, you almost have to, because the aging population is growing, and
Right.
so you have to have these conversations, and you have to demand that your doctor make time to have conversations with you when you go to the doctor's office. I mean, one of the things that I always work on some of my patients and their families is to write down before you go to the doctor's office the questions that you have, to help you not only not forget some things that are important to ask, but also to be able to have a way to sort of control the time that's limited in the doctor's office with what's really pertinent. So I have lots of patients who have multiple chronic medical illnesses. When you go to your doctor's office now, you don't have 20 minutes to talk about all of your problems and all the chronic illnesses that you have. Your doctor really wants to know, what are you there for today?
Right.
So if you come into your doctor's office and there's something that has affected you since your last visit, you really want to make a list of maybe the top 3 or 4 questions that you have or concerns. So you go in as your own advocate, saying, look, doc, this is what's happening with mom, or this is what's happening with me since the last time we were here. What can we do about it? Do you also have some resources? And one of the things that our organization is doing is trying to train people to become advocates in whatever social issues are important to them.
Absolutely.
Because we cannot depend on community-based groups anymore, and organizations that have been cut back to do the kind of advocacy for you. So you now have to inform yourself, use the language that's out there, and be able to do some of the research to see what it is that you think is going on, so that you can say specifically, these are my symptoms, these are some of the
Right.
things that are sort of bothering me these last few weeks that's different from the previous 2 weeks when I was last in touch with you, and then go into your doctor's office with that information. It helps to make you feel better about your role and your care, and it also helps to guide the doctor with what you're there for that time that you're going to see him or her.
Absolutely, and that's really important, because it's a scary time anyway, right? And and just back to how we use this whole activism, this advocacy to really start to, educate people. I think it's great that we're having this discussion. So if now someone's sitting at home and they're like, okay, I've been putting this off for a while. I think, perhaps I think this could be me. There isn't really any sort of, diagnosis that you can buy online or pop to the chemist or the pharmacy to get, something just to say, okay, well, I have this. So, just in terms of the signs, there is no real diagnosis as such. So if people are fearful to go straight to the doctor, what are some of the things that they can do just to see if, if they are connecting all the dots?
Well, I mean, I really think the first thing people should do is call the Alzheimer's Association New York City chapter. The calls are confidential. If you want to be anonymous, you can be anonymous. And speak to a helpline staff member. It's an 800 number. It's free, 800-272-3900.
Say that one more time.
800-272-3900. And I think that's really the first thing people should do, because it is confusing, it's scary, and people begin feeling angry, at the person who's acting a little more peculiarly than before, who's also not aware of that, who's, as I said, who's defensive or blaming other people for things that they're actually doing. So I think that's really the first thing. I mean, I'm part of the staff, so I mean, I am biased, but I really think we are a great staff. We really are. We most of us have been through this experience, like you've been through this experience. I've been through this experience, or we've known people intimately who have been through the experience. We study, we think, we talk together, we work together. I mean, I think that we're like Planet Alzheimer's, and I think as soon as people come to us, they feel immediately relieved. They're not alone, and the feeling of being alone with this is just awful. The isolation, and then you feel terrified, and then you can't make decisions, and things are really getting out of control. It's really a wonderful thing to see how people just relax, can speak, feel comfortable sharing feelings, they can't share with other people.
And I just want to add to that as well, because if a person isn't able to get to a hotline, or they don't really know that the information is out there, I would say if you have a person in your home with a loved one who's suffering from dementia, you need to have a historian. So there needs to be someone who can capture when they've recognized some of these symptoms have begun, and be able to document that, so that when you go to the doctor's office, you have some idea around when you started noticing that your mom or your dad was behaving oddly, or driving past the house because they forgot where they lived, or because they were very confused, or they forgot sort of basic things like cooking. So you want to be able to have that person in the home who can have that information somewhere listed in a place they can always go to and say, okay, I can start to remember maybe around this time noticing for this number of weeks that this person was behaving in these ways, and be very specific, because you need that when you go in, so that you can then advocate for some of the services that you may eventually need, like home care.
Okay, yeah, absolutely.
Yeah. No, a family historian is really a great thing for a lot of different reasons.
Definitely a wonderful suggestion. And I mean, and unfortunately, Ralph Scott, who inspired this conversation, was stuck across town in the wrong studio. But what we do have, though, is the wonderful trailer to Barbasol, which is his film, a short film that has been doing the rounds, obviously within the mental health community and Alzheimer's and dementia. But, it's been in film festivals, and it's certainly a way of us being able to spread messages of social issues that really affect us through film festivals, through screenings and that type of thing. So if we have that, it would be great to show Barbasol by Ralph Scott, the trailer. Thank you.
You gonna go see the chief today?
Yeah.
Take your son with you.
Boy, get up. You're coming with me.
Must you yell at him like that? You make him nervous.
Sunlight makes him nervous.
By Ralph Scott. We couldn't unfortunately manage to have him in the studio, but we have, his trailer and his film, so that was wonderful. And, and actually it's so great because this is what gave me the idea to do a show around, the brain, our biggest friend, our biggest computer. So I'm so happy to have had you on as my guest, Asha Tari and Wendy Pankin, Wendy Pankin from Alzheimer's Association, and Tasha from the collective,
the collective advocates for social change
the
and
collective
development.
Okay, wonderful. So tell everybody how they can reach you.
So if you're on social media, you can actually reach us on our website, www.thecollectiveadvocates.com, or on Twitter at The Collective A, or on Facebook at The Collective Advocates.
Okay, at Collective A on Twitter, I'll remember that. And Wendy?
Right, the Alzheimer's Association New York City chapter, www.alznyc.org, and the helpline 1-800-272-3900.
Wonderful. So I'm so glad that you guys are out there outreaching and and being the compassion in the community that we need to see and drawing attention to this very important issue. Thank you so much for joining us on Ancestor House. My name is Dami Akanusi. Really enjoyed your company this evening. I hope you've enjoyed our wonderful guests. Join us again next week. Until next time, thank you very much.
We must learn and tell a story, heal the pain and raise the glory. Tell it, tell it, tell it, tell it, oh yeah, tell it. We must learn and tell our story, heal the pain and raise the glory. Tell it, tell it. We must learn and tell our story, heal the pain and raise the glory. Tell it, tell it. Not to know the family story is bad. Not to want to know it is worse. For to pass on ignorance to someone is like, it's like passing on a curse. And it will curse your father, curse your mother, curse your sister, curse your brother. And every time you come close to one another, it will be there in between to separate and instigate.